Welcome to another episode from the Veterinary Research Channel. Today, we're diving into a fascinating area of canine cardiology, specifically myxomatous mitral valve disease, or MMVD, the most common heart condition in our beloved dogs. This condition is a progressive disease. Some dogs live relatively normal lives, while others succumb to congestive heart failure. Even when dogs reach the stage where their heart has enlarged, known as ACVM stage B2, the rate at which the disease progresses is different for each dog. And while many dogs with congestive heart failure die within a year, there is still variability in survival. This makes it challenging for veterinarians to predict what will happen, advise owners on checkup schedules, and decide how aggressively to treat the condition. In this episode, we will explore a recent study that attempts to tackle this challenge. Researchers have been working to find a simple and reliable way to predict how MMVD will progress in dogs, and their work has led them to investigate a new index called the Mitral Regurgitation Severity Index, or MRSI. So, what is this Mitral Regurgitation Severity Index, and how does it work? The formula includes a few key factors: heart rate, the size of the left atrium compared to the aorta, the main artery leaving the heart, and the dog's age. All of this is multiplied by 100. The investigators wanted to know if this index could predict when a dog with MMVD would develop congestive heart failure, or if it could predict death from any cause. They also wanted to see if it was better than just looking at those individual factors alone, such as heart rate or age. Finally, they wanted to know if a regular practitioner could use X-rays, rather than echocardiograms, in the MRSI equation, making it more accessible. To answer these questions, the researchers combined data from 4 previous studies, giving them a large group of 869 dogs. These dogs had already been diagnosed with MMVD, specifically stages B2 or C. Stage B2 means that the dog's heart has started to enlarge because of the disease, but has not yet developed congestive heart failure, while stage C means that the dog has congestive heart failure. Let's take a closer look at how the study was conducted. The researchers collected information from the dog's medical records, including their age, breed, sex, weight, heart rate, and the size of their left atrium. They also noted any medications the dogs were taking. For some of the dogs, they also had X-rays of their chest, which they used to measure the size of the left atrium using a method called vertebral left atrial size. Using this data, the researchers calculated the MRSI for each dog. They then followed the dogs over time to see who developed congestive heart failure and who died. By comparing the MRSI scores to these outcomes, they could determine how well the index predicted the course of the disease. Now, for the results. In dogs with stage B2 MMVD, the MRSI did a pretty good job of predicting who would develop congestive heart failure. A MRSI score above 156 was predictive of CHF. The dogs with a score above 156 developed congestive heart failure, CHF, at a median of 407 days, compared to dogs with a score of 156 or less, who developed CHF at a median of 1,404 days. The researchers also found that a MRSI score above 173 was predictive of all-cause death. Dogs with a MRSI above 173 had a median survival of 868 days, compared to dogs with a score of 173 or less, who had a median survival of 1843 days. The MRSI also proved to be superior in predicting outcomes when compared to individual variables of heart rate, age, and the ratio of the left atrium to the aorta. Interestingly, the researchers found that they could substitute the LA/AO measurement with radiographic measurements, and the index was still significantly predictive of outcome in stage B2. This is important because it means that general practitioners who may not have access to echocardiography can still use the MRSI to assess the severity of MMVD in their patients. However, when the researchers looked at dogs with stage C MMVD, the MRSI was not as reliable. It did not consistently predict outcomes in this group. So, what does all of this mean? The MRSI appears to be a valuable tool for predicting the progression of MMVD in dogs, particularly in stage B2. By calculating the MRSI, veterinarians may be able to identify dogs who are at higher risk of developing congestive heart failure or dying from the disease. This information can then be used to make more informed decisions about treatment and monitoring. The researchers also compare the MRSI to another scoring system called the Mitral Insufficiency Echocardiographic, or MINE, score. They found that the MRSI performed similarly to the MINE score, but the MRSI is easier to calculate because it uses fewer variables. The fact that radiographic measurements of the left atrium can be used in place of echocardiographic measurements is also a major advantage, as it makes the MRSI more accessible to veterinarians in general practice. Of course, this study has some limitations. First, the data was collected retrospectively, which means that the researchers were looking back in time. This can introduce bias into the results. Second, the dogs in the study came from different sources, which means that they may not have been entirely comparable. Third, not all of the dogs had complete data, which could have affected the results. Finally, the choice of denominators used to adjust the MRSI components was somewhat arbitrary, though it did not impact the prognostic performance of the MRSI. Despite these limitations, this study provides valuable insights into the prognosis of MMVD in dogs. The MRSI is a promising tool that could help veterinarians better manage this common and challenging disease. To put these findings into context, it's helpful to understand what other studies have shown about predicting outcomes in dogs with MMVD. Previous research has identified several factors that are associated with a worse prognosis, including increased resting heart rate, increased left atrium to aorta ratio, increased left ventricular internal diameter, increased transmitral peak velocity in early diastole, decreased left ventricular fractional shortening, increased vertebral heart size, increased N-terminal pro-B type, natriuretic peptide. Increased age. Researchers have also developed other indices that combine these variables, such as the predict model, the mitral insufficiency echocardiographic (MINE) score, and the clinical severity scoring system. While these indices have been shown to be useful, they often require complex formulas or advanced echocardiographic measurements, which limits their use in general practice. The MRSI, on the other hand, is a simple formula that uses readily available variables, making it more practical for everyday use. One of the key findings of the study is that the MRSI can be used with radiographic measurements of the left atrium. This is important because radiography is a more accessible diagnostic tool than echocardiography, particularly in general practice. To understand how this works, let's take a closer look at how left atrial size is measured on radiographs. The most common method is called vertebral left atrial size, or VLAS. To measure VLAS, a line is drawn connecting the most dorsal point on the vertical VHS line to the most caudal point on the horizontal VHS line. This line is then compared to the length of the dog's vertebral bodies, starting at the cranial endplate of T4 and extending caudally. Another method is called modified vertebral left atrial size, or MVLAS. To calculate MVLAS, a second line is drawn from the most dorsal border of the left atrium toward the VLAS line, intersecting the original VLAS line at a perpendicular angle. So, why is it important to be able to measure left atrial size on radiographs? The size of the left atrium is an important indicator of the severity of MMVD. As the disease progresses, the left atrium becomes enlarged. This enlargement can lead to several problems, including atrial fibrillation, pulmonary hypertension, congestive heart failure. By measuring left atrial size on radiographs, veterinarians can get a better sense of how severe the MMVD is and how likely the dog is to develop these complications. Short sound effect, heartbeat. In addition to predicting the onset of congestive heart failure, the MRSI was also found to be predictive of all-cause death in dogs with stage B2 MMVD. This suggests that the MRSI is a useful tool for assessing the overall prognosis of dogs with this disease. However, it is important to note that the MRSI is not perfect. It is just one factor to consider when assessing the prognosis of a dog with MMVD. Other factors, such as the dog's overall health, response to treatment, and the presence of other diseases, should also be taken into account. Despite its limitations, the MRSI is a valuable tool that can help veterinarians better manage MMVD in dogs. By using the MRSI, veterinarians can identify dogs who are at higher risk of developing congestive heart failure or dying from the disease, make more informed decisions about treatment and monitoring, provide clients with a more accurate prognosis, ensure equal disease severity within study groups in a research setting. In conclusion, the Mitral Regurgitation Severity Index, or MRSI, is a simple and readily available tool that can help predict the long-term outcome in dogs with myxomatous mitral valve disease, especially those in stage B2. By incorporating factors like heart rate, left atrial size, and age, the MRSI provides a valuable assessment of disease severity and can assist veterinarians in making informed decisions about treatment and monitoring. Its accessibility, with the option to use radiographic measurements, makes it a practical tool for both specialty and general veterinary practices. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.